Hey everyone, so I wanted to get back into the swing of doing videos, and I've been doing pretty good, so I had a new idea for a video that I haven't covered yet, and I'm surprised I haven't thought about this because I have a child myself, but, so the topic of this video is basically bipolar and having children, and if you're thinking about having children, and you know you have some form of mood disorder or bipolar spectrum disorder and you're thinking about having children, I just wanted to give you some information to think about before you make that decision, because it can be a difficult one to make depending on where you sit specifically on the bipolar spectrum and what your family history details. So I'm just going to read what I prepared for you. So before you make a decision on having children when you have bipolar, you need to look carefully at your own family history and understand that your child may have the worst disease your family could produce, or the mildest, or no disease at all. Your child could be normal, but even a normal child might carry the disease and pass it down to future generations. Bipolar disease is not necessarily fatal unless your family is one with multiple suicides, in which case you might view the disease differently than those bipolar families without suicides. Bipolar is treatable, like all chronic diseases, but some cases are more easily treatable than others. The susceptibility to treatment runs in families too. Ask yourself, does your family have the type of bipolar that responds well to medication? Or does it require a number of drugs to reach a kind of shaky equilibrium between stability and mood swings? Many people with bipolar are able to lead full, productive, and rich lives. They don't get into trouble, use illicit drugs, drink alcohol to excess, get into financial trouble, or suffer too much, because they have good or even excellent control of their illness. Others, however, may never be completely in control, and that could be for a variety of reasons. Having children is a big responsibility, and one that is more often than not tiring, frustrating, demanding, and stressful to the average person. All of these things can throw off an unsteady bipolar into complete chaos. So if you choose to have children, you'll need support during times of instability so that your children will have as stable a life as possible. Ask yourself another question. If one of your children has bipolar or has some other form of mood disorder, would you be able to handle the added stress and emotional turmoil this would inevitably bring to your family? My advice to you is this: know your stressors and have a plan in place to help you. A new baby is going to cause lack of sleep, and lack of sleep can destabilize anyone, especially someone with bipolar. Be prepared for the worst, but don't expect it. You're going to need support during pregnancy when your hormones are making bipolar symptoms that much harder to deal with. You're also going to need someone to keep a close eye on you after you give birth, as you are at an increased risk for postpartum depression and unfortunately psychosis. So 3 things. Know your triggers, have a plan, and have support from family and your friends. I worry all the time that my daughter will have a mood disorder, but if she does, I'm going to know what to do. I'm going to be her advocate. I'll be there to help her better understand herself, and most of all, I won't love her for any less for being who she is. I knew the risks I was taking when my husband and I decided to have a baby. I know that having bipolar 1 can produce a more extreme mental illness like schizophrenia. I keep a very close eye on my daughter, and I know quite a bit about mental illnesses, not just about bipolar, so I keep a very close eye on her behavior, and if there happens to be anything in the future that I become concerned about, I'm not going to hesitate in taking her to a doctor immediately. Because the sooner that you get help and the sooner you get diagnosed and on medication, the more stable you can become, and the easier it is for you. If you're one of those people that was undiagnosed for years and are now on medication and are still finding daily life a struggle, I think personally it has a lot to do with the genes that are responsible for the disease. I think the longer that they have lain undormant and unmedicated, the harder it is for you to get the disease under control. And that's just from what I've seen from personal experience with people that I know with bipolar, and stories that people with bipolar shared with me. So if you're thinking about having children, do some research and make sure you know your family's history really well. Even talk to your doctor or people in your family if you're not fully aware of your family's history. So you have like a clear picture of your family's mental health background, and you can make a more informed, smart decision based on the facts that you have. So until next time, remember to stay strong, and you're never alone.